Want to dedicate the next half hour of the show talking about a special event that is coming to East Brunswick later on this month. It'll be on Thursday, October 18th. A terrific event that is put together by our good friends at Keep Middlesex Moving. It's called Transportation Challenges for Healthcare and Business. And the registration, seating is limited, and the registration is going on right now. And joining me this morning in the Procure studios to talk about some of the important topics that are going to be covered. He's the former mayor of East Brunswick, a small business owner, of course, the chair of the Middlesex County Regional Chamber of Commerce and the Central Jersey Convention and Visitors Bureau, and also the executive director of KMM. And he's obviously a very busy guy, and I want to thank him for coming by today. Our good friend Bill Neary is here. How are you, Bill? Good to see you.
I'm fine, Vern. Nice to see you so early in the morning.
Thanks for coming by. Greatly appreciated. You know, when I drive around in Middlesex County, and if I'm on Route 1, and a lot of times you'll have traffic and rush hour and whatnot, sometimes I'll see an ambulance or something trapped in the traffic, and there's a median, and I'm thinking, oh, my God, why can't I be Superman? And I would just put my cape on, and I'd grab that ambulance, and I'd lift it up, and I'd take it to the hospital and maybe save someone's life or help a response time. That's one of the things, just kind of getting around, particularly with the healthcare and business, is one of the things we're going to talk about on October 18th, right? What are some things we're going to cover?
Well, it's an interesting concept when you think about transportation in general. Most people, when they think of transportation, think of getting in a car and driving,
sure,
or getting on a bus or a train. But there's a whole issue out there about people who really don't have transportation. They lack it for either financial reasons or health reasons, or even they're disabled. And access to care is a critical part when you're talking about creating a healthy community. And I think that's what the goals of the hospitals are. This is an event being co-sponsored and actually by an organization called Healthier Middlesex.
Mm-hmm.
Healthier Middlesex is a consortium of St. Peter's University Hospital and Robert Wood Johnson Barnabas Hospital, who has a community health initiative program, a CHIP, that they go out to try and reach a way to make the community even more healthy.
And I guess it's kind of getting the word out about transportation options. I know ride sharing is playing a role in this too, right?
Well, well, the ride-sharing part, when you think about how complicated it could be, a perfect example to me is personally, my mother-in-law, who's in a nursing home, needed to get her defibrillator checked last Friday at a cardiologist. From the nursing home to the cardiologist is about 4 miles. She can't do it on her own.
Right.
My wife had to take a day off from work. I worry about my wife and her back and everything else. We're trying to get her out of the wheelchair. So there's all kinds of issues about access to care that people don't think about directly. But people need these type of services, and there certainly is a gap. An ambulance is the basic way people would get to a hospital.
Sure.
But if you have a serious issue with either dialysis or chronic care, diabetes, cancer, any of those type of things, you need regular doctor appointments, not even hospital appointments. Getting there is always a challenge.
Yeah, and it's point A to point B, which is something that everybody kind of deals with in different ways. Mayor Cahill was here last week from New Brunswick, and he talked about some of the programs where they'll actually provide riding trips back and forth for people for visits to doctors and whatnot. But when you're talking about heavy-duty things like dialysis, that's a completely different sort of challenge.
Well, New Jersey Transit does have Access Link,
okay,
which is a nice program, except it is not necessarily cost-effective. It's very expensive.
Oh, sure.
The rider would pay only a small fee, and the cost of involvement is really expensive. They're even talking about, when you're talking about the economics of access to care, the studies have shown in 2015 there was $150 billion lost or spent on no-shows, people who couldn't get to the doctor.
On no-shows?
On no-shows, when the appointments are canceled. And
wow.
So, I mean, that's added into your insurance costs.
Oh, sure.
I mean, so
somebody pays for that. You're right.
Somebody pays for that.
Yeah, it's true.
So when Mayor Cahill may have an innovative program, and it's a great thing to do for the residents of New Brunswick, but if you live in South River and you have to get to the doctor in New Brunswick, it's not going to necessarily be the type of program you can use.
Yeah, exactly. So this is going to be covering the Middlesex County and the region about some different options, and we're going to be talking about the challenges that the medical industry faces when it comes to providing transportation to clients and patients. So you want people that are affiliated with the medical industry coming to this bill? You want business people to come to this? Who do you want to attend on the 18th?
Yes.
Everybody.
Yes and yes.
Virtually everybody can
come away with something. Because it does affect everybody. And I think that's one of the things that's why this is a little bit more unique, because I think the people who are in the medical industry have a better understanding of it. And I think that's important for them to understand it, but they're not necessarily going to be working on solutions because they're busy providing medical care.
Of course.
The business community, I think, is always the one who's maybe innovative and looking at the impact it has on the morale of the workers, their employee retention, and even workforce development itself is going to be part of the panel, because you're healthier if you have a job.
That's very true. Very true.
And so this discussion is going to be based upon 3 different panel discussions that we're going to have. It's a half-day session. The program is going to go from 8:30 to 1:30. It's at the East Brunswick Community Arts Center, so I want people to be able to know they can register ahead of time and come. We'd be happy to see them. We're going to have a little bit of a breakfast and lunch, and then we're going to do some polling about people who know about this type of information.
Interesting stuff. Yeah, transportation challenges will be covered. We'll also talk about the transportation policies, and as Bill had mentioned, about the impact on health and business that it has. And also, we're going to talk about some solutions. What I like about the KMM events, Bill, and thank you for inviting me to be your host and moderator.
Well, thank you for
I'm
joining
looking forward to that. Solutions are always discussed. Whether we were talking about the future of the electric car here in New Jersey, we've done a couple panels at St. Peter's. The solutions that come out of these events, I think, are what people kind of take and they implement. So there's going to be, when there's a solution component to an event, I think people come away with some information. That's why I would urge people to come to this on the 18th.
Well, thank you. And I think KMM's been around for 30 years. Most people don't understand what a Keep Middlesex Moving Transportation Management Association is. We are a nonprofit, and we work on different alternative transportation discussions. We don't have any vehicles. We don't have any drivers.
Right.
But we have at least part of the management of transportation, and that's what the program's all about, is to try and provide discussion, potential solutions, and at least get this conversation elevated.
Absolutely. You're right. And you can register for the event. Seating is limited, so we do urge you to register now. It is coming up a week from this Thursday. It will be in East Brunswick. You can visit the KMM.org website and sign up there. Bring along as many people as you can who you feel could possibly learn something from this. But sign up at that website. And also, while you're there, there's information on you can receive traffic alerts from KMM if things are kind of happening. You need to take a different way home or a different way to work or something. There's apps. You can download an app also with some great information. Ride-sharing information's on the website too, right, Bill?
Ride-sharing. And tomorrow is Walk Your Kids to School Day.
Is that tomorrow?
Yes.
Okay,
yeah.
Good. Get all that at the website, kmm.org. We'll come back. We'll spend some more time with our special guest, Bill Neary, next. It is 7:20. Bill Neary from Keep Middlesex Moving is with me inside the Procure studios this morning, giving you the information on the upcoming event that is happening, Transportation Challenges for Healthcare and Business, Building a Healthier Middlesex County. You can register for the event now by visiting kmm.org. It'll take place in East Brunswick on Thursday, October 18th, beginning at 8:30. We'll have a nice breakfast at the beginning. We'll have a couple panels. We'll have a working lunch and some polling that will happen too. But it is certainly urged if you're a medical or business professional, whether it's anywhere in Middlesex County or the surrounding region, you are urged to join us for this free half-day conference. And again, you can register very simply at kmm.org. We'll have a lot of great information. I'm excited to be the host and moderator of this event, so certainly you will join me, join Bill and I for what's going to be a lively discussion with some solutions. We'll talk about some answers in there as well. Speaking of getting around Middlesex, Bill, of all the places that the governor chooses to talk about his audit of New Jersey Transit, he's been very vocal and very critical of New Jersey Transit, as have the people that ride the trains and get stuck in Penn Station every night. Where did he choose, of course, to come out and talk about the results of the audit, but he'll be in Middlesex County later today?
Well, we're happy to see the governor here, and we know that New Jersey Transit is digging itself out of some issues that they've faced over the last several years, and I'm glad to see that's coming along. At KMM, we do provide transit guides, and we promote the transit opportunities that people have. We do have an enormous amount of transit in Middlesex County with the county transit system and with the New Jersey Transit, but it's still there's so many needs that can't be met. It's almost impossible.
Wow. And so if you're maybe make the commute to New York, or you ride a New Jersey Transit train or bus every day, you know what? See what KMM has available, because you never know. It's going to be one of these days. How many times, Bill, does someone go to a train platform here in Jersey in the morning only to realize that there's no train? Now what do you do? Now you're kind of stuck. But you know what? Thank goodness groups like KMM and the surrounding management associations who work in their various counties, there's resources there. There's at least you have some choices. At least you kind of know going into the game that you got problems, right?
We try to help. We'll try help trip planning and those type of programs also. We have a lot of individualized type of programs we can work on.
Yeah.
Well, this conference we're talking about, you mentioned earlier about the panels.
Sure.
Beyond the panel, we also have, we're fortunate to have Senator Patrick Duggan as our keynote speaker.
Excellent.
Senator Duggan is a Middlesex County resident, represents Middlesex County, but he's also the chairman of the Transportation Committee in the state. Good
guy to have there, sure.
And he knows his stuff, and he'll be happy to impart the information that's coming in terms of New Jersey Transit funding and the infrastructure investments that the state are making that makes things better.
Yeah, so a lot of great information is going to be shared that day. Again, mark the date and join us. It's Thursday, October 18th, beginning at 8:30. And it will be in East Brunswick with KMM. We'll be there. We'll have some panel discussions and just kind of share some ideas and share some information. Healthcare mobility, best practices and solutions, and it is a free half-day conference. Just register in advance at kmm.org, and you're going to come away with some good information with your business, that's for sure. Bill, some numbers just came out this morning with regards to traffic deaths across the country. New Jersey, a little bit of an uptick, particularly with what's kind of upsetting when it comes to pedestrian fatalities on the roads of New Jersey. You'd think about, well, just crossing a street, how hard could it be? But it's so challenging nowadays. We have increased congestion. Traffic is higher than ever. I don't know about you, and you probably see it just as much as I do. I've never seen so many people run so many red lights in my life. It seems like it's a problem that's just getting worse before it gets better. Are there any solutions on the horizon? I know a lot of times you talk to groups, you talk to seniors, you go into the schools, and you talk about pedestrian safety. It's something everybody needs to kind of work together on, isn't it?
Well, I think it's basic common sense. But, of course, if people are in a hurry, sometimes they lose their common sense. And you're right. People either I think there's always a problem about the stopping on red, that people don't necessarily stop. I think it's a problem. There's a cultural differences. People coming in from different parts of the world and the country have different ways of driving and walking. Mm-hmm. So I think there's a lot of issues there. We have a special senior pedestrian program because seniors are especially vulnerable.
Sure.
I think that's part of maybe because medication has changed, they've slowed down a little bit, or whatever it is, or maybe because they don't have access to a car as much, they walk more.
Yeah.
But so that we have a special program we do at the senior centers throughout the county that try to remind them about safety and about reflective gear and those type of things to be seen. But it's a national problem. Mm-hmm. Pedestrian fatalities are up. Cars are safer today. People seatbelt themselves more today. People don't drink and drive as much as they used to.
Which is good.
So the fatalities in an automobile has necessarily been reduced over the course of years. It's gone a little bit more uptick, but it's come down quite a bit. Pedestrian fatalities continue to spike.
Yeah, that's the important thing. And don't just assume a car is going to stop. You know, I understand that when you're in the crosswalk, you're supposed to have the right of way. But I can't tell you, Bill, how many people will lay on their horn behind me. I come to a complete stop, and I wait till the person is completely out of the crosswalk before I go. And people behind you they lose their mind.
And that's the law.
You're supposed to, of course.
That's the law. You're following the law.
Even though they're not directly in front of your car, they're in that crosswalk, you stop until they're back on the sidewalk. And you save lives that way, Bill. That's how it's done.
And the other part that we try to remind people about pedestrian safety is everybody's a pedestrian. When you get out of your car, you're a pedestrian.
That's right.
Shopping centers are pedestrians. I mean,
boy, parking lots. That's another challenge. Yeah.
So people in parking lots are driving in circles looking for a place to park, not looking for cars or people or shopping carts or anything else. So.
Yeah. And the other thing to remember too, the regular laws of the road apply in a parking lot. People forget that. Well, it's a stop sign in a parking lot. I'm not stopping. That's not for me. You run a stop sign in a parking lot. That's just as serious as running it on a road. Yep. People don't realize that, Bill. It's crazy, isn't it?
It's some of the things we keep on working.
Yeah.
If I just
keeping you busy, that's for sure.
It's keeping Middlesex moving. There you go.
That's right.
Well, I don't know how difficult that is either, but we know Middlesex is frequently not moving as fast as everybody wants it to be. But maybe that's better too.
Yeah.
In terms of the panel discussion, I want to make sure we finish up before we run out of time.
Sure.
The panels do have more of a high-level approach in terms of the problem itself from different people. And the people from NJTPA, Workforce Development, they're going to be talking about that. We have 4 people who are actually concerned about this issue personally. They have anecdotal stories. One is disabled, one is 2 are seniors, and one is economically challenged. And the final panel, which I think is the most interesting one, are people who actually do provide these type of services.
Good.
And how it's going to be. The Uber Lyft idea and the concept of Ride for Life, there's people who are actually doing these type of at least initiatives to start making changes.
All right, great stuff. So we certainly hope that you'll join us coming up on the 18th of October, beginning at 8:30 in East Brunswick for this free program, Transportation Challenges for Healthcare and Business. Again, absolutely free. Just register at kmm.org and join us. We'll have some panel discussions, breakfast, lunch, and it'll be a very productive and very informative day that we're looking forward to. Bill Neary, thank you as always, and we look forward to seeing you on the 18th. And thank you again for putting this together and for giving me the privilege of hosting it that day. Look forward to it. So thank you again.
Thank you very much, Bart.